Hello, and welcome to the Tahoe Center for Orthopedics pre-surgical class for spine surgery. We know that you have many choices when it comes to your health care, so we sincerely appreciate you choosing Barton Health. The disability that goes along with back and neck pain severely impacts quality of life. Whether you've been living with pain, not able to do the things you want to do, or both, your spine surgery will very likely give you back that quality of life. So without further ado, let's jump into the program. In this presentation, we'll be talking about how to prepare for your surgery, understanding your surgery, and what to expect with your hospital stay, with rehabilitation, and with your recovery at home. The content in this presentation is also in the spine booklet that your surgeon gave you or will be giving you soon. Our goal for you is, quite simply, to get you back to the activities and lifestyle you're used to, and to do so as quickly and safely as possible. You're going to want to have somebody available to take you home from the hospital after your surgery and then stay with you for the first week. Remember, this is a major surgery and you will need help. These meals are invaluable if your caregiver isn't available to cook when you're hungry. Our home health therapists have either contacted you or will be contacting you to schedule a home safety assessment. If you live locally, we will arrange a time to come to your house and perform a home safety assessment. If you are an out-of-town guest, our therapist will conduct the assessment over the phone. Nonetheless, here are a few tips. Remove throw rugs and small objects such as pet toys and shoes from the floor. Add pillows to low chairs or sofas. Prepare a bedroom on the main living area. Make sure electrical or phone cords are not crossing walkways. Make sure you have non-slip mats inside and outside your bathing area. If you have a step-over tub, you may need a tub transfer bench. And a commode can be very helpful to elevate the toilet seat or have near the bedside. Before your surgery, you will need to obtain surgical clearance from your primary care physician. You will also want to discuss your medication regimen with your primary care doctor or your pharmacist prior to surgery. Our preoperative coordinators will let you know which medications to take on the day of surgery. Blood work, chest x-rays, and an EKG are required prior to surgery. Blood work must be completed within 7 days of surgery, and the chest x-ray and EKG can be within 6 months if they have normal results. Preparing for your hospital stay, the following items are recommended. 2 to 3 pairs of comfortable, loose-fitting clothes, slip-on shoes or slippers with non-slip soles, books, magazines, or leisure activities that can be used in bed, and glasses if needed. Be sure to label all of your belongings. Things you don't want to bring to the hospital include jewelry, personal medications, money, ATM, or credit cards. If there are any changes in your physical condition in the days before your surgery, it is very important that you let your surgeon know. This includes colds, coughs, or any new injuries. If you become ill the night before surgery, please notify the nursing supervisor at 530-543-5736. On the night before surgery, it is very important that you do not eat or drink anything after midnight. This includes water, mints, candy, and chewing gum. The only exception is a sip of water with medications that you have been specifically instructed to take. It is okay to brush your teeth or rinse your mouth out, just be sure not to swallow. It is also important to refrain from smoking, using smokeless tobacco, and consuming alcohol for at least 24 hours prior to surgery. On the day of surgery, you will report to the surgical desk in the front lobby of the hospital. This kiosk is just inside the main entrance to the hospital. Our representative will activate your account, give you an identification wristband, and escort you to the ambulatory surgery unit. Please know that your surgery time is subject to change. If it does change, you and those accompanying you will be notified. Also, note that you should not wear contact lenses on the day of surgery. If you need corrective lenses for reading, please bring your reading glasses. Once you are in the ambulatory surgical unit, you will be introduced to the nursing staff and your height and weight will be taken. You will then change into a surgical gown and we will confirm your identity and what specific surgery you are having. The surgical team will then continue your preparation for surgery and conduct a coordinated review of your medical and surgical history. Please know that you will be asked the same question by many members of our surgical team. This redundancy is intentional and purposeful. We want to be absolutely sure that the right surgery is performed on the right person every time. Prior to your surgery, you will meet your anesthesiologist and he or she will explain how your anesthesia will work. After that, an antibiotic will be administered and then you will be given medication that will relax you and allow you to go to sleep easily. This will most likely be the last thing you remember prior to going into the operating room. We'll now take a few minutes to discuss the normal anatomy of the spine and what occurs when there are injuries or degenerative diseases in the spine. The spine is made up of individual vertebrae which give us structural support and also provide a protective canal for the spinal cord. In between each vertebrae are discs that allow increased movement of the spine while also providing cushioning between the bones. The space created by the discs also makes room for nerves to exit the spinal cord and go to other parts of the body. On the back part of the vertebrae are small facet joints which, in conjunction with the vertebral discs, provide stability while allowing for mobility. There are many disease processes or conditions that can cause problems with your spine. Bulging or herniated discs can push on spinal nerves and cause pain. Disc thinning, arthritic changes, and shifts in the vertebrae's position can also cause pressure on the spinal nerves. To decrease pressure on the nerves, there are a few different procedures that your surgeon can perform to decompress the area. A discectomy removes the bulging or herniated part of the disc that is pushing on the nerve. A laminectomy removes small portions of bone to give the nerve root the ability to move freely. If the spine has become unstable because of disease processes or injury, your surgeon may decide to fuse the vertebrae together. In this process, the disc is removed and replaced with bone. Typically, the surgeon will use plates and screws to stabilize the joints while the bones fuse. It's good to know that when you wake up after surgery, you'll have quite a few things on your body. You'll have an oxygen mask on your face, a blood pressure cuff on your arm, a pulse oximeter on your finger, an IV in your arm, your incision will be covered in surgical dressings, and you'll have compression stockings and compression pumps on your legs. You may also have a catheter in your bladder, a drain from the incision site, and a neck brace on if you've had cervical spine surgery. In the recovery room, you will receive pain medication and any other medications indicated by your doctors. At this time, the surgeon will notify your family that the surgery is complete and will be able to answer questions they may have. You will stay in the recovery room until your vital signs are stable and you are awake. At this point, which is usually about an hour or so, you'll be transferred to the nursing unit on the second floor. When you get up to the second floor, our nursing team will get you acquainted with your room, check your vital signs and circulation, assess your surgical site, and help you manage any pain you may be having. We will be doing everything we can to expedite your recovery. Patients who have had lumbar surgeries will also be fitted to their back braces at this time. It is very important to us that your pain is managed well. When this is accomplished, you are able to move with less difficulty, get in and out of bed easier, participate in therapies, and rest soundly and comfortably. Please know that it is your responsibility to request pain medication. If your pain is progressively increasing, you need to let the nursing staff know right away. Do not wait until your pain is severe before asking a nurse for pain medication. It is much easier to manage lower levels of pain than to try to bring high pain levels back down. We often use cold packs to help manage pain as well, so feel free to ask for one if you'd like. With any surgery, there is always the risk of complications. Some complications, such as nausea and constipation from anesthesia and pain medications, are very common, and we will work very hard to help manage those issues. Prevention of more serious complications like pneumonia, blood clots, infections, and falls are taken very seriously. Our rehabilitation team has 6 basic goals for you to achieve. Get in and out of bed on your own, get on and off a chair or toilet safely, walk safely with an assistive device, dress yourself with minimal assistance, go up and down stairs safely, and return home within 3 days after surgery. If you've had a lumbar surgery, we will also want you to be able to put your brace on and take it off safely, as well as demonstrate the ability to log roll. Your occupational therapist will work with you on getting dressed and undressed safely, toileting, bathing, using adaptive equipment, and protecting your surgical site during normal daily activities. After your spine surgery, there are a few movement precautions we want you to remember. No bending, no lifting, no twisting. Just remember, avoid the BLT, bending, lifting, and twisting. During your stay with us, you will be participating in physical therapy twice a day, occupational therapy once a day, and you will be expected to get up and eat all of your meals out of bed. It is our goal to get you back home within 3 days of your surgery. In the unlikely event you are not ready or able to return home, you may be referred to a skilled nursing facility or an inpatient rehabilitation center. Our case managers will coordinate the care you need to leave the hospital. Your doctor may recommend home health services to assist you with your recovery at home. This team includes registered nurses, physical therapists, and occupational therapists, all working together to promote your recovery as quickly as possible. Preventing infections and caring for your surgical wound is very important. Be sure to keep the incision and dressing clean and dry, which means no showering until your surgeon says so, and clean your hands thoroughly before changing your dressings. You'll want to have someone examine your surgical site daily for any signs of infection. These signs include redness, tenderness, increased temperature or swelling around the incision, drainage that looks like pus or smells bad, persistent fever greater than 101 degrees, or increased pain with both activity and rest that is not being controlled by your medications. Please notify your home health nurse or surgeon immediately if you develop any of these signs. It's important that you continue the medication that was given to you prior to leaving the hospital. If your pain medication is not relieving your pain or you are having unwanted side effects, please do not hesitate to call your nurse or surgeon. As mentioned earlier, preventing complications is of utmost importance to us. Measures to prevent blood clots will continue during your recovery at home. If you are given compression stockings, you'll want to wear them until your follow-up appointment with your doctor. However, be sure to remove them once a day to inspect your skin for breakdown. Continue the foot pumping exercises that the nursing and physical therapy teams instructed you in while at the hospital. Lastly, be mobile. Getting up and moving every hour or two helps prevent blood clots as well as pneumonia while promoting circulation and healing. We don't expect that you will have a blood clot, but we do want you to know the warning signs just in case. Signs that you may have a blood clot include increased pain in your calf, ankle, or foot, increased swelling in your calf, ankle, or foot, tenderness or redness above or below your knee, and that area may be warm to the touch. If you develop or even think you may be developing any of these signs, contact your home health nurse or surgeon immediately. We are hopeful that this operation will help you get back to the activities and lifestyle you are used to, and we are committed to helping you get there as quickly and safely as possible. We sincerely appreciate your patronage and look forward to making your experience with us positive, rewarding, and successful. If there is ever anything we can do to enhance or improve your time with us, please do not hesitate to ask. From all of us here at the Tahoe Center for Orthopedics and Barton Health, thank you for choosing us and congratulations on taking the next step to a new you.